OXYCONTIN is the time-release form of oxycodone which is typically prescribed for chronic and severe pain. Due to the fact that it can contain a large amount of oxycodone, it has become one of the most abused prescription drugs in the United States. Overview: OXYCONTIN is a semi-synthetic opioid analgesic prescribed for chronic or long-lasting pain. 1. The active ingredient is oxycodone, which is also found in drugs like Percodan and Tylox. OXYCONTIN can contain between 10 and 80 mg of oxycodone in a timed-release tablet, compared to about 5 mg a day in Percodan. How it's used: generally, OXYCONTIN is prescribed to be taken twice a day, a benefit over other pain-relieving medications that have to be taken several times a day. OXYCONTIN is available in tablet form in 7 dosage levels from 10 to 80 mg. It is usually prescribed to help patients with chronic pain, such as back and neck pain. It may also be prescribed to cancer patients to help decrease pain and improve function. How it's abused: people who misuse OXYCONTIN use the medicine in amounts or ways that are not prescribed or intended. They can either crush the tablet and ingest or snort it, or they dilute it in water and inject it. Crushing or diluting the tablet disarms the timed-release action of the medication, but crushing OXYCONTIN in this way can give the user a potentially fatal dose. 2. In 2010, the FDA approved a new formulation of OXYCONTIN to prevent such tampering. The drug maker, Purdue Pharma LP, made changes so that breaking up the tablet does not immediately release oxycodone. Also, if someone attempts to dissolve these new tablets for syringe injection, the liquid becomes gummy. Despite these measures, the FDA continues to admit that abuse and misuse of OXYCONTIN remain possible. Further, there is an increase in OXYCONTIN abusers who are turning to heroin because it is a significantly lower-cost opioid. According to a 2013 study, nearly 80% of American heroin users reported misusing prescription opioids like OXYCONTIN and Vicodin before they were introduced to the illicit street drug. 3. Some of the street names for OXYCONTIN include Oxy, OC, Cotton, Kickers, Ox, OCs, Beans, Rushbo, Orange County, Killer, and Hillbilly heroin. It is frequently mispronounced and misspelled as OXYCONTIN. If you or a loved one are struggling with substance use or addiction, contact the Substance Abuse and Mental Health Services Administration, SAMHSA, National Helpline at 1-800-662-4357 for information on support and treatment facilities in your area. For more mental health resources, see our National Helpline database. Effects under the prescribed dosage: OXYCONTIN is an effective pain reliever. When crushed and snorted or injected, the drug produces a quick and powerful high that some abusers compare to the feeling they get when doing heroin. The National Institute on Drug Abuse, NIDA, reports that in some areas of the country, OXYCONTIN abuse rates are higher than heroin abuse. OXYCONTIN, like heroin and other opioids, is a central nervous system depressant. An overdose can cause respiratory failure and death. Some symptoms of OXYCONTIN overdose include clouding of mental functions, cold and clammy skin, coma, confusion, dizziness, loss of consciousness, nausea, reduced vision, seizures, slow breathing, respiratory depression, small pupils, tiredness, vomiting, weakness. In case of overdose, if you believe someone has taken an overdose of OXYCONTIN, call 911 immediately. Narcan, naloxone hydrochloride, is an emergency medication designed to counteract an opioid overdose. First responders can use it to revive someone if they can reach them soon enough. If medical attention is received promptly, there may be few long-term consequences of an overdose. When treatment is delayed, an overdose of OXYCONTIN can be fatal or result in permanent brain damage. Is it addictive? Like all opioids, OXYCONTIN has the potential to be highly addictive. Due to the potential for abuse, OXYCONTIN is a Schedule II drug under the U.S. Controlled Substances Act, CSA. Even pain patients who use the drug as prescribed are advised against suddenly stopping OXYCONTIN use. Instead, the dosage should be gradually reduced to avoid withdrawal symptoms. However, very few people who take OXYCONTIN as prescribed become addicted to the drug. People who misuse the drug and take a higher than the prescribed dosage can develop a tolerance for OXYCONTIN. This can cause them to take ever-increasing amounts to achieve the same effect. It is possible to become dependent on the drug rather quickly. Withdrawal symptoms. OXYCONTIN withdrawal symptoms can begin as soon as 6 hours after the last dose and can last up to 1 week. For people who have gone through OXYCONTIN withdrawal, compare the process to the intensity of heroin withdrawal. Constant yawning, depression, diarrhea, heart palpitations, hot, cold sweats, insomnia, joint and muscle aches, nausea and vomiting, tiredness or fatigue, uncontrollable coughing, watery eyes.